everyone, and welcome back. I hope you all had a chance to get up and perhaps enjoy maybe a Tim Hortons coffee or some water and just get a quick break in. I know that was a little longer than we expected, but maybe that's best. Just stretch your legs. Welcome back. It's my pleasure now to introduce Dr. Hogan. I'm just going to make sure you're unmuted there on my end. Can you hear me? Okay.
I can. Can you hear me?
Oh, I can, yes. Welcome. Hi, how are you? Yeah, so it's my pleasure to, I'm well, thanks. It's my pleasure to introduce you, Dr. Hogan. Dr. Hogan was born and raised in Windsor, Ontario, and completed his dental school training at the University of Michigan in Ann Arbor. Following dental school, he completed his hospital-based dental residency at Northwestern Memorial Hospital in Chicago. He's now the dental residency program director at Loyola University Medical Center in Maywood, Illinois. The hospital-based dental practice at Loyola has dedicated itself to treating medically and mentally compromised patients of all ages, both in the clinic setting and in the operating room. Dr. Hogan is very passionate about resident education, hospital dentistry, and has been active with the Scleroderma Foundation at the local and national level for many years. Dr. Hogan, it's our absolute pleasure to have you here with us today. I will pass it over to you to get started, and thank you for being with us.
Sure, of course. Thank you for the invitation. Let me share my screen here. Can everybody see that?
I can, yes. Yeah, we can.
Okay, excellent. I will keep an eye on the chat, I guess, or you can throughout. I think everyone's been doing questions at the end, but normally I would tell people just to.
Yeah.
Okay. Normally I would tell people just to throw up their hands and cut me off if I start rambling. I will get through this. So thank you for the invitation. Very, very honored to speak to this group. So thank you. I will talk to you today about some of the oral manifestations of scleroderma. We could come up with a laundry list of things. I've tried to narrow it down to about 7 that we see most commonly in our clinic and in patients that we treat. So we'll just talk about those, and then some things that you can ask your dentist, or things your dentist can do for you, and then some things that you can do to help yourself. So you touched on already, but just a real quick thing about myself. So I work at Loyola Medical Center. It's just outside Chicago. Sister Jean is one of the nuns at our university, and she kind of put us on the map a couple years ago when the men's basketball team made a surprise run to the Final Four. So some people didn't know, Loyola is a smaller university, some people didn't know who we were until the basketball team made a run. So one of the best parts about my job is that, there, I cranked up my volume, I hope that helps. Best parts about my job is that we get to work with dental residents. And so every year we get graduates from dental school to come spend time with us at the hospital. Some young, amazing people. So it's great. Sound is not good.
I'm wondering if that was just before you adjusted your volume, because I can hear you okay from my end.
Okay.
So let's just see if there continue to be issues. If anyone could let us know in the Q&A, that'd be great.
Okay, yeah, please keep me posted. So we have a very interesting setup. We're a dental practice within a big medical center, and we get to meet some really, really interesting people and help out some really special people too. So we're very, very lucky. I am very, very lucky. Trying to advance my slide here. There we go. Real quick here. So I am here in Chicago on the far left. We were all supposed to be gathered here in Niagara Falls. And I was born and raised just outside of Windsor, Ontario. So I'm a very proud Canadian. So I'm always very honored to speak to this group, but especially the Canadian group. So very, very honored for that. So thank you very much. I do not have any disclosures, so I will show some products and talk about some things that may help some people, but I do not work for any of these companies. I don't have any financial interest in them. So if I'm telling you something or talking about something, it's just because I think that it might help, or that patients have told us that it really does help. So objectives here, like I said, we'll talk about some oral findings associated with scleroderma, what your dentist can do to help you, what you can do to help your dentist and yourself, obviously, a few little tricks, and then we'll do some questions. So a lot of people have been talking previously and will throughout the week too, that are way smarter than myself, that can talk about some of these things, but the next couple of slides are just a very quick overview that all of you probably already know, just the main forms, and then just how many systemic implications are seen from this disease. So cutaneous issues, and we'll talk about some of these a little bit later. Vascular issues. Yesterday, some good information on pulmonary hypertension, issues with the lungs, the heart, kidney, musculoskeletal and rheumatological issues, GI issues, endocrine and neurological. So basically, long story short, obviously everyone knows, but just affects so many different organ systems potentially. And so we just need it to be a team effort. So you probably have a lot of different people on your team, on your care team that's taking care of you, rheumatologist, cardiologist, physical therapist, nutritionist, maybe a dentist. And so the quarterback of the team needs to be the patient. And so I have a couple pictures of quarterbacks here, Tom Brady, and I threw in Doug Flutie for the CFL fans here. And just need to make sure that there's always open communication lines and excellent communication between the patient and all of your healthcare providers. So you need to make sure that you assemble your team that can help you the best. And we need to put it on ourselves as healthcare providers to really communicate with other specialty groups as well. Okay. So these are kind of the 7 things that I've tried to narrow it down to, that we'll go through one by one. 5 of them are things that we see when we examine patients during our clinical exam, and then 2 of the things we find on x-rays. So we'll just talk about that real quick. And some people, maybe your dentist or an oral surgeon has pointed these things out to you already, but we'll go through one by one. So dysphagia is a fancy word for difficulty swallowing, and it's caused by atrophy of the muscles of the esophagus. And so your muscles need to work in order and in precision to move the food down the GI system. And sometimes when the muscles have atrophied, you have trouble getting food down your system. It can also be from the xerostomia. So a lot of times when we're talking to patients, we'll spend a lot of time on our patient interview and going over things. Yes, I will try and speak up. Is that a little bit better? Please let me know. The dry mouth can also cause difficulty swallowing. And so sometimes particles of food and things when you put it in your mouth will get stuck to the sides of the cheeks. And so patients, when we talk about difficulty swallowing, initially we might be talking about the muscles, but then patients will kind of keep talking and lead us down the road of the dry mouth, which we'll get into a lot later. So it can be two things involved in this. We always monitor during, like I said, our patient interview and our exam. Okay. I went 1 too far ahead here. Okay, I will continue to speak up. I think they said that's better here. So limited mouth opening. There is a collagen deposition in the connective tissue that can lead to fibrosis and over time, a limitation of mouth opening. Okay, so we always measure when patients come in. So even if you're coming in every 2 weeks for something, or we see you once a month, the first thing we always do is take a measurement. Okay, so there's fancier little gauges that we can use to measure how big you can open. What we always like to use in our clinic, it's very simple and easy. They're these little disposable rulers, just made out of paper, and it's a quick measure. So it takes less than 5 seconds. As soon as we lean the patient back, that's the first thing that we always do, and then we document it in the chart so that we know if things are getting worse or moving the wrong way, right? So that is a problem for a lot of patients, or a challenge, I should say. If you have a limited mouth opening, it might be difficult for you to get back there and clean your teeth, and to floss and to use a toothbrush and things like that. And also for the dentist, very challenging for us to get our instruments back there. So our drill, or even if you're seeing someone to have your teeth cleaned, if you can only open a very small amount, it can be tough to get our instruments in our hands back there. Okay, so we always measure and document this. This picture here is hopefully to show some of that, the fibrotic nature of the tissue, and kind of the pursing of the lips here. I really wish, and I'll have to work on it for next time, that I took a video instead of a still shot. So I could have had this patient, I would have asked her to open and close, and you could really see how difficult it was for her to open and close. She had issues with her jaw joint, but her challenge as well was because her skin would just not allow her to stretch. Okay, so things were very, very tight, and it made treating her a challenge. So we had to come up with some interesting ways to try and take impressions and do some dental work on her. So I need to work on getting a video there, but hopefully you can kind of sort of see this tissue, instead of being nice and stretchy like an elastic band, very tight, like leather. That's what I know that might be a bad analogy, but when we're speaking to our residents and trying to train people and talk to them about it, that's kind of how we sometimes describe the nature of the skin just not having the elasticity that it normally would. So that can be a challenge for us sometimes. Xerostomia is a fancy word for dry mouth. So it can be caused by the destruction of the salivary glands, and those produce your saliva. And it can cause, challenges and trouble with a whole bunch of things. Your ability to eat, to speak, to chew, all of these things, saliva helps with those things. So a lot of patients are sometimes also taking medications that can reduce their salivary flow. They might be taking medications for different systemic issues, either related to scleroderma or not. And some of these medications can cause a reduced salivary flow. Okay, our saliva is the best thing that we have to help fight cavities and to regulate the normal flora that is in our mouth. Okay, you have a normal flora in your gut of bacteria, the good and the bad bacteria, and we need to have a good balance of that. And it's the same thing in the mouth. So your saliva helps regulate the good and the bad bugs, if you will, in your mouth. And so if we do not have a good amount of saliva or a normal amount of saliva in there, sometimes it can lead to fungal infections and things like that. So we could talk, or I could talk for days just on xerostomia and saliva. It is so important. But we'll only talk for a couple minutes here to keep everyone awake and also not to eat up all the time. So xerostomia is a very big challenge for patients and providers to deal with, but we do have some things that help, so that's a good thing. We can try salivary substitutes, so there are a lot of gels and sprays and rinses that patients can use. Biotine has a lot of products that are great over the counter. And the biggest thing is water. Okay, so we tell patients, always walk around with a bottle of water, okay, or sugar-free drinks. Okay, so again, sugar-free is, people might roll their eyes when the dentist is talking about sugar-free things, of course, but makes a huge difference. If you're rinsing with something like a Mountain Dew, or you're drinking something like a Mountain Dew or an orange juice, something that's very high in sugar and very acidic, it might be helping your mouth feel better as far as the dry mouth, but you're adding to the problem of increased risk of getting cavities. So water is the best thing to keep your mouth nice and moist. And then we'll take a sip of it. We do have some medications that we can give patients. Healthcare providers can give a prescription for medications that will stimulate your saliva. So that is a possibility. We give out pilocarpine a lot of times to patients with Sjogren's or patients who are undergoing or have finished chemotherapy or head and neck radiation. We see a lot of patients like that at the hospital. And so sometimes a prescription is needed, but hopefully not. The goal is not to have to give you something through prescription, but hopefully we can make you comfortable using natural things and over the counter. Okay. Cafesol is a mouth rinse that comes in 2 little capsules that you mix together and you swish, and it does a really nice job of lubricating the mouth. That is a prescription. But like I said before, Biotene has a whole bunch of products that are great, from toothpaste to mouthwashes to sprays that really do a good job of lubricating the mucosa, the insides of your cheeks, your tongue, the floor of your mouth, the roof of your mouth, things like that, to really help with the dry mouth. Okay. I do have some pictures here in the next couple slides of, I'm a nerd, and I always go down the aisleways of the grocery store and the pharmacy, in Canada, I think Shoppers Drug Mart, maybe. In the US here, it's Walgreens and CVS are the 2 big ones. But I always roam the aisles and take some pictures, obviously sometimes just to be up to date and fresh on what we can offer our patients or talk to them about that's over the counter, okay, that we don't have to write a prescription for, that is much cheaper, and a lot of times works just as well or sometimes better than some of the things that we can give you a prescription for. Okay, so Biotene, like I said, has a whole bunch of dry mouth rinses and things like that. The Walgreens brand for us, or the Shoppers brand in Ontario, is the exact same thing, just a little bit cheaper. So I think a bottle of normal mouthwash I think is maybe $5 or $6. These ones, as you can see, are a little bit more, but not exponentially more. And they do a really nice job. So these are over the counter. You can check them out in your grocery stores and your drug stores as well. Okay. ACT has a really good gum, and also the mouth rinses as well. Okay, so there's so many different products. There's shelves and shelves of it that you can kind of sort through. So like I said, a lot of our patients try these out and give us some feedback. So that's why I'm putting these in here. One is not better than the other, but I just want to make people aware of them. This slide here, I love, and I could probably talk for 30 minutes just on this slide. I'm going to try and do it in 2 minutes. It's mouthwash, okay? And the biggest take home from this slide would be alcohol-free. Okay, so a couple of these you can see alcohol-free, 0 alcohol. And so if you have severe dry mouth or any form of dry mouth, and you're rinsing with a mouthwash that contains alcohol, it will dry out the tissue even further. Okay, so if you suffer from xerostomia, from dry mouth, we strongly recommend that you try a mouthwash that does not have any alcohol. One of the most well-known and a very good product is Crest Pro Health, is alcohol-free, and ACT has one as well that's alcohol-free. Okay, so things like Listerine and Crest with Scope, again, very good things. And the alcohol is what gives you that feeling when you rinse and you swish around and then you spit it out and you get that burning, that feeling that feels amazing in your mouth. It feels like it's getting everything nice and fresh. That's just the burning from the alcohol. Okay, so if you rinse, and I've tried all of these, every single one on here, with the Crest Pro Health, you don't get that burning sensation after. And so you're thinking, is this doing anything? Is this thing even working? It is, but it doesn't have the alcohol to give you that burning feeling. Okay, so dry mouth, alcohol-free mouthwash, and another big thing here, ACT Restoring. So a lot of these ACT mouth rinses have a very high concentration of fluoride, and fluoride helps restore teeth and helps fight cavities. Okay, so it can prevent demineralization. It can help with remineralization of the teeth. And ACT Restoring here, I believe, has the highest concentration of fluoride that you can get in a mouthwash that is not a prescription. Okay, so ACT is very good for everyone to use, but especially people with dry mouth who are trying to prevent decay on their teeth. Okay, again, lozenges, sprays. We have a whole bunch of different things here. Okay. This one here I wanted to throw in, and this was taken, as you can probably tell from my bathroom counter. I use this periodically myself. It is alcohol free, and it's very good for patients that sometimes suffer from ulcers and a certain form of mucositis, things like that, for whatever the case may be. It's a very soothing mouth rinse. Okay, so it's more to keep you comfortable. It doesn't have any, antifungals or anything. It's over the counter. I have not seen a drugstore or a grocery store that has it. I get it on Amazon. Okay, and so you can get it dropped off probably within the hour from the Amazon drone to your front door. But this is a fantastic product that we give to a lot of our cancer patients at the hospital who have issues with ulcerations and things like that in their mouth. So I just wanted to talk about that quickly. What we do a lot in the hospital is we can mix up mouthwashes, okay, or mouth rinses for patients. So we need to identify what the problem might be, and if it's a fungal issue because of that normal flora has been disrupted, or palliative to make them feel better if they are in pain. We can mix up different compounds that we can prescribe to patients. So I thought this picture was kind of funny given the time of year especially, but we can mix up whatever we need to. Sometimes it's all of these things in one mouth rinse that patients will use. So something very interesting that our dental residents get a good experience and kind of have fun, figuring out which one to prescribe. Okay. Increased risk of periodontal disease and decay. Okay, so periodontal disease is gum disease, and this is all related to the severity of the dry mouth. Okay, so like we talked about, your saliva really helps maintain things in your oral cavity, keep the pH of your oral cavity intact. And so if you have dry mouth, it puts you at an increased risk of both gum disease and dental decay. So our job is to be on top of that and get you in for more frequent follow-ups to monitor. So instead of coming in to have your teeth cleaned every 6 months, we might have you in every 3 or 4 months. Okay, we might be more creative or aggressive in treatment planning to kind of look down the road a little bit more instead of just snapshot of that day and what we see. We might take everything into consideration, knowing the nature of your condition, knowing if we've been taking our measurements and we keep seeing a decrease in your ability to open, we might be a little bit more aggressive. And hygiene too sometimes becomes difficult because of issues with manual dexterity. Okay, so ability to use your hands and get to those hard to reach areas. So sometimes patients have difficulty because of their inability to open, but also sometimes ability to use their hands. So a lot of times we see patients with autoimmune conditions, they have multiple. Okay, so we might have patients with scleroderma plus rheumatoid arthritis or lupus or something that's affecting their joints. And the hands, of course, with scleroderma as well. So ability to wrap floss around your fingers and get to the back molars might be very difficult for patients to do. So we need to be able to help you do that. Okay. Fluoride varnish is something that we will always do after we see you in clinic. It is a very high dose of fluoride that we basically paint on the teeth. It's sticky like a maple syrup type consistency. So it kind of feels yucky on the teeth, but it's fantastic. And both medical and dental people are able to apply fluoride to the teeth. So a lot of times when we go on mission trips or to areas where, there might be one dentist within 200 miles or, 350 kilometers, sometimes we do teach our medical colleagues how to do this. Okay, so fluoride varnish is fantastic. Widening of the periodontal ligament. So the next two are things that we see on x-ray. So let me jump ahead one slide and then I'll try and go back. So the periodontal ligament surrounds the root of the tooth in bone, and it's supposed to be real nice and tight. If you think of pulling a sock over top of your foot, if you have a knee-high sock, So if you pull a sock up to your, over your foot and up to your knee, that would essentially be what the periodontal ligament or the PDL of a tooth is. Very, very thin, surrounds the root of the tooth down in bone, and it acts as a shock absorber and keeps the teeth nice and tight in with the bone. So if it's wide, it's supposed to be very, very, very nice and tight with the bone. If we see a widening of the periodontal ligament like we do here, it can lead to mobility of the teeth down the road. And we don't really know what causes it, and we don't have a fix for it. Okay, but it's just a finding on x-ray. So this image here is from that patient that I showed earlier to talk about the tissue. And she shows this on almost every single tooth. It would be a classic for dental students on a board exam or something like that. They would show an x-ray and say, what is the most likely systemic condition involved with this patient, and the answer would be scleroderma. Okay, that's how common it is. We see it very often. So just wanted to point it out in case your dentist may have pointed it out to you. Okay, mandibular bone resorption is another one, related again to the fibrosis of the tissue. So the muscles that attach to bone, again, instead of being very elastic, become very fibrous, and over time it wears away on the bone where they attach. Okay, so it's often seen at the angle of the mandible, which is kind of just below your ear. And so we see it on x-ray. Okay, so that might be something that gets pointed out to you as well. GERD is a very common one that everybody can keep an eye on. So both patients, dentists, physicians can all keep an eye on GERD. And we can see it in the teeth, okay? Sometimes if it's very bad. So things that can help with this: patient positioning when sleeping, medications like proton pump inhibitors or antacids. Your diet can help. So we will lean on our colleagues who are nutritionists a lot of times to speak with our patients in a diet that is low in acid, low or no caffeine, and no eating before bed are things that can help. Okay, so enamel is the outer layer of your tooth. It's that white shell that is on the outside of your tooth. And GERD, the acid that is brought back up into the oral cavity can wear away that enamel, okay? And the layer underneath the enamel is a little bit more brown and yellowish in color, and we can see that here, okay, on all of these teeth and on the molars too, okay? We call that pitting of the molars, and it's worn away that outer layer of the tooth, which is not a positive thing, okay? So things that your dentist can do to help you, like we said before, early intervention and frequent recalls. Excuse me, being creative in our treatment planning. Sometimes aggressive, that might not be the right word, but proactive would maybe be a more appropriate word, knowing that the back areas and the difficult areas are probably not going to get better. It just might become more difficult as time goes on, so it might be a little bit more proactive. It is our job and our responsibility to make sure that our staff knows all about your condition and about a whole bunch of different conditions of patients that we'll see, so that they know how to help us, hopefully give you the best quality of care. So our front desk and our dental hygienists and our dental assistants and our residents, they know one of the first things that we'll do when we see one of our patients with scleroderma, we'll give you a blanket, right? Because we know that patients are chilly sometimes, or we have extra sets of gloves. Most of our patients with scleroderma have their own gloves with them, a lot of times on in the waiting room, even if it's July, because of issues with rhinos and things like that. But we have blankets, so that's one of the first things that we do, because everyone in our office is aware of some of the things that are related to different conditions. Okay, so we need to be able to speak with our medical colleagues as well to help you out. Communication is huge, and in 2020, I don't think there's an excuse not to communicate with all the different ways of doing that, whether it's through text, and now our pagers at the hospital are forwarded to our phone, and so we get paged 2 different ways at the same time. Email, now everyone's learning how to do Zoom, as we're currently doing right now. So there's no excuse not to communicate. Okay, so things that you can do to help your dentist, and obviously in turn yourself, is just talk to us. Okay, so let us know how your condition affects you, medications that you're taking, challenges that you're having, and just be open and honest with us, and so that we can be aware of those things. Fight the dry mouth. Okay, that's one of the biggest things, challenges for patients and for us, is to come up with ways to help you fight the dry mouth. Patients, we ask them to be, very detailed and consistent with their hygiene. And this goes without saying, but just a healthy lifestyle practice. So, exercise and rest and diet and things like that are very, very important, as everybody knows. Okay, so a few little things to finish off here, little kind of tips or tricks or interesting things that we've learned and that patients have taught us, which is really cool. Flossing aids. So again, if there's difficulty wrapping the floss around your fingers and getting to those hard to reach areas, there are flossing aids to help you. So there's a little piece of floss in between here, and it kind of looks like a little slingshot. You hold the handle back here, and you can get to those hard to reach areas using these little things. They come in packs of like 10 or 12, and I believe that they're relatively cheap. The soft picks are amazing. I have them in my little middle console of my car, my little glove box. When I'm sitting in Chicago traffic, I just pick at my teeth with these little things, and I think that they're great to help get in between your teeth. Okay, toothbrushes. So that's a big thing. Bigger handles are easier for people with dexterity issues. Okay, so we can build up that handle using a whole bunch of different things. So sometimes it's rubber bands, foam padding, hockey tape, tennis balls, anything we can. So I have a couple pictures on the next slide that I'll show you, and also electric toothbrushes. Okay, so let the brush do the work, and you basically just need to hold it in different areas, and the little wheels spin, as you know. So electric toothbrushes are great and very popular. Okay, these are over the counter, again, from the drugstore, ranging from just like everything else on our planet, cheap to very expensive. Okay, so $30 to 120. Okay, all of these different ones. So there's the Oral-B, the Sonicares, the water picks. They all do a great job. You can buy those. You can just walk in and buy them. Okay, we also sell them in our office to patients. We can get them usually cheaper through our vendors. So this is just taken from our hygiene area. Our hygienists have a little picture of each of those. Okay, like I mentioned before, getting creative with the handles. Okay, so wrapping them. If it's a manual toothbrush, a regular toothbrush, if you will, wrapping the handles and putting a tennis ball on. Okay, so that people can hold it and grasp it easier. Okay, implant dentistry is changing our patients' lives in a great way, and it's a good way to restore function and aesthetics. We have great long-term success. And every single year, or every single month even, we're learning more and getting better at the science behind it. So we're learning how they interact with the body and things that we can do and maybe shouldn't do with implants. So there's no yes or no, definitive, this person has diabetes, they cannot get an implant, or this person has scleroderma, they cannot get an implant. Not true. In this patient, there was a thought that patients with Sjogren's and severe dry mouth and things like that are not good candidates for implants. This study was just a few years ago in 2017, shows that that's not the case. Okay, so implants, very high survival rate, low bone loss, and low biological complications. So tissue was not irritated, no infection. So those are all very good things. Okay, so we place implants and restore implants every single day in our clinic with our colleagues in oral surgery. It's a great service to the patient. Okay, final thing here are ways to improve your maximum opening. Okay, so we can give you little tips and tricks to try. The cheapest and easiest thing is to use tongue depressors, and those are just popsicle sticks. Okay, so you can stack them up. They're very cheap, like I said. You can get a whole box, I think, for a few bucks. Okay, and it gives you 500. You stack them up, and each day or every couple days, you just add a few popsicle sticks to your stack that would slowly increase. So you put it in your mouth, leave it in there for 30 seconds or a minute, take it out, give your mouth a break, stretch it again, and that can help increase or maybe not increase, but just slow down the progression of your limit opening. Okay. And lastly, here are a couple devices that we can give you through a prescription. They have a lot of parts and usually involves writing a letter and trying to get it covered by insurance because they don't come cheap. But there's a Therabite and an Orastretch. Okay, so Therabite is on the left, Orastretch is on the right, very similar. And as you can see, there's these little bite forks that you put in your mouth, upper and lower, and then you press the handle, which is back here. And when you squeeze the handle down, the bite forks open up. Okay, so that stretches your jaw. We give this to a lot of patients after surgery to help them almost as a form of physical therapy to stretch their jaw. And it can work in patients with scleroderma as well. Okay, so I tried to be as quick as possible. I know we're tight on time here, but as everyone knows, many systemic manifestations, some of these lead to issues in the oral cavity that we need to be aware of and continue to learn about. The common findings that we see, that we discussed, hopefully some ways that your dentist can help you, and then ways that you can help your dentist just by being very compliant, be open and willing to trying new things or different products. And that is pretty much it. Okay, so thank you so much again for the invitation to speak. My email address is here, so please feel free. I'm happy to share slides or pictures or anything with anybody. And also, you can feel free to email me at any time as well. I really mean that. So happy to help in any way that I can.
Thank you so much, Dr. Hogan. I can see we've got a few questions there. Can you see them as well?
Yes. I don't know if I'm going in the proper order here. The first one I see here, I'll just read out loud. Doctor, the frustrating thing about the products is that their effect is so temporary. Repeated daily use can get expensive. Rakan took me off these. He said, now it's not around for Scardo and drugs, we're not doing anything. Potentially, yes. So like a lot of things, we hopefully don't want to have you on these forever, right? So your body can get used to them, just like an antibiotic, right? So if we overprescribe antibiotics, then they won't work when we really need them. So that's a challenge that we do face. So I don't have a great answer for that one. Unfortunately, it can happen where the drugs don't work if we use them all the time. Let's see here. Of the medications that are used, are some worse than others for causing dry mouth? You know what, it really depends, and everybody is affected differently by different meds. So there are some that are a little more, that tend to cause dry mouth a little bit more. Antidepressants, a lot of cardiac medications like beta blockers, ACE inhibitors, diuretics, those seem to be the main ones, but there are a lot of different medications. Even an antihistamine can really cause dry mouth. So there are many that can cause dry mouth. We have other people that are on all of those drugs that we just said, and they have no issues. So it's very, very case by case. Next one here. I have had an implant that completely failed, filled 3 times broken. Last time they said the implant had actually cracked and removed. And now if I pick another case, would it fail because of Hogan's scleroderma? Again, very hard, and I promise I'm not tiptoeing around this, but it's hard to say what the cause of failure was for specific people. Again, our studies do show that having Sjogren's and scleroderma is not a reason in itself to not place a dental implant. Okay, so there might have been other factors involved that I can't comment on without knowing more information, so I'm sorry. I don't know whether time experience I've suffered many suggestions for locating such a dental office. That's a great question. It was saying, I read through it quickly, sorry. Trying to locate an office that is comfortable and has experience and interest in treating patients with scleroderma. I don't know a good answer. A lot of hospital-based offices should have experience with that. So I guess it would depend on where you live in Alberta. I do know that some of the hospitals, or one for sure in Calgary, does have a dental residency, hospital residency like our program and like many in the country that are in Calgary. And I don't know where you live, but you can shoot me an email if you want. I'll be happy to try and help you find somebody. Have you seen a higher prevalence of TMJ issues in scleroderma patients? Without having research and data available to me right now to speak on, my over a cup of coffee answer would be yes. We do, and I think a lot of it is because of other issues with the connective tissue and ways that it affects the joint. So yes, the jaw joint is no different than the other joints in the body. Asking for pediatric equipment may help, absolutely. So asking and using pediatric bite blocks definitely helps, and we've even gotten creative with our little bits that we put in the drill. We've cut those off so that they're not as long, and so they're shorter, so that we don't need as much room to get in there. So that's a great point. So we use a lot of pediatric things. Hello from Windsor. Yes, wake up mouth and teeth have film no matter what I do. Have used biotin affecting my taste? Yes, I do. That's going to the whole mouth. So having a film on the teeth when you wake up in the morning, again, hard to say what it's from. And I'm just reading here. Wake up in the mouth and teeth have a film. No matter what I do, I have this taste in my mouth. So I think this question is asking more about a continued or prolonged taste in the mouth. And again, that can come from so many different things, from deficiencies in the diet to a whole bunch of different things. So I don't have a great quick answer for you. Awesome on the warm blanket. Okay, great. Yes, warm blanket is huge. Every single patient that walks in, we put out our ruler and our warm blanket, because we know those are the two things we're doing first. Even more so than the restriction in my mouth opening, experience tightening the soft tissue inside the mouth. Yes, tissue at the back molar area that joins the top and bottom, it pulls so much and is quite painful. Suggestions for trying to stretch this out. We have tried sometimes to ask patients to sometimes use their finger, and I'm going to try and demonstrate here. You kind of massage the inside, and sometimes we've even used a spoon, a metal spoon, to get it in your cheek and really try and stretch out that tissue. How effectively that works, it's hard to say, but we'll tell patients a lot of times with your finger, and you can stretch, or taking a spoon and using the spoon to stretch. I don't know if that demo makes sense or works or makes me look like a fool, but I don't know. But we can sometimes use a spoon to try and stretch out that tissue, because that's a huge challenge for us when we're trying to treat patients and we need to retract the cheek to get at some of those back molars. We just are not able to do that with our dental mirror. Okay. It's been recommended previously that club soda helpful for dry mouth. You can use, so explain why. I have heard of that. Honest answer is I don't know why. I honestly do not. I have heard of some patients saying that club soda does help, and I do not know the answer. I apologize. Which hospital in Calgary? I do not know the name of the hospital, but I can look it up and let you know. I don't know off the top of my head. I would have to look up. I just know from different presentations and kind of email lists that come out to residency programs that there are some in Canada, and one of them is in Calgary. So please send me an email, or I can send it to Alicia or someone to get to, but I will find out which hospital. I'm sorry, I don't have that right away. And shifting your jaw to one side or the other can give better access to back teeth. Absolutely. Yeah. So if you move your jaw side to side, can help us get to those hard to reach areas. I agree.
That's fantastic. Thank you, Dr. Hogan. It looks like we've reached the end of the questions that we had waiting for us for now. I will be sure to follow up with you if that's okay about that hospital and anything else that I've made some notes and anything else that was left unattended. And then I can circulate that information I've been sharing with our conference registrants that we will offer like a resource page of some sort. We'll follow up with what that's going to look like, but I will include the location when I get it from you once you've had a chance to find that answer for us. Can you hear me okay? Sorry.
Sounds great.
Okay, thank you.
Let me stop sharing here, see if that's better.
Yeah, no problem. And I'll turn my camera back on as well. Can you hear me all right?
Hello? Hello, can you hear me?
Yeah. I think it's on my end. Can you hear me okay?
Can you hear me or no?
I can.
Kind of. I can kind of sort of sometimes.
I think it might be on my end. Okay, thank you so much for your time and your expertise.
I'm sorry.
That's okay. Thank you so much for your time today. We appreciate your
Absolutely, yes. You're welcome.
As a specialist in this area of scleroderma for dental. You're so hard to come by. So you're very sorry. Are you there? Can you hear me?
I can, yes.
Oh, there we go. I'm so sorry. So I don't know if you heard that. I just wanted to say you're so valuable to us, you know, specialist in the area of scleroderma when it comes to dental practices. So hard to come by. So thank you.
Yes, my pleasure. Thank you for the invitation.
All right. Have a great day.